My name is Dr. Grossman. I'm a trauma surgeon, and I'm demonstrating today insertion of a chest tube in a simulated patient. The interesting part is that I wanted to record that with a regular smartphone camera, the traditional recording, also with the perspective of the surgeon's view with a Google Glass device, and also with a ThetaS camera on a 360-degree panoramic angle, so that eventually that recording can be set up on a Google Cardboard or any other 360-degree viewer, so that we can manipulate the image and have a more immersive perspective on how to do the procedure. So obviously the most important thing to begin with is having a set of universal precautions ready for you before you start any procedure. I'm going to obviate all of that for the purpose of the recording. Sterile gown, obviously gloves, a mask, and a shield. So we're not going to review indications of this procedure, but basically we're going to follow up the way of doing this regarding a chest tube placement via the ATLS, or Advanced Trauma Life Support, convened way to do it. So in any case, I have a chest tube, and this one is a 32 French chest tube, and as you can see, the chest tube has a set of numbers, and this is very important because the chest tube also has a set of openings which are all supposed to be in the inside of the pleural cavity, and the numbers start right at the last hole in the chest tube. So the last hole will be number 1, and then you go from there to up to 20 or so. But you got to make sure that this last hole is inside the pleural cavity. That's why it's important to keep an eye on the actual numbers. First of all, what we do is we set up our device, and we have a chest tube with a clamp in it, a Kelly clamp or so. That's going to help us insert the chest tube in the pleural cavity. And then we have everything in our side table. We should obviously use a sterile technique, so we would be painting the area on the patient's chest. This is all obviously simulated, and then we would be securing a sterile field as we usually do it. I'm going to obviate that part as well. And then we choose the space where we're going to do this, and usually it is in the 4/5 intercostal space, and you want to make about a 2 centimeter or so incision, okay? And the incision will allow you to enter the subcutaneous area, and then with the help of another clamp, a Kelly clamp, you can then sort of dissect the tissue up to the level of the top of the rib in the intercostal space, and puncture the pleural cavity. Once you puncture the pleural cavity, you want to put your finger inside and make sure that you can feel the inside of the pleural cavity, and you will feel the lung inflating. By inflating, the lung will allow you to tell whether there are any adhesions between the tissue, the pleural, parietal pleural tissue, and the actual lung. You don't want to force it, because then you will end up doing damage to the lung parenchyma. So once you are in, again, by guiding you with the instrument, you can place the tube at the right length, going either up or going down and posteriorly, depending on the indication of this procedure. And again, if you look at the numbers, you want to make sure that your last hole is in the patient's pleural cavity. That way you are not going to create a persistent air leak. And this is it. I think that this obviously is a life-saving procedure. It should be a sterile procedure. And again, I wanted to demonstrate the potential of different types of recording devices to make this a more educational and hopefully interactive and hopefully immersive experience with the help of the Google Cardboard, for example, or any of the other cardboards out there, the VR1 or the ViewMaster. There are many of them which are very inexpensive and allows you with a 360-degree recording software to have an immersive experience in the actual room where the procedure is taking place. Thank you very much.